Welcome to today's session, and what I'll be talking about today's session is the medication drug chart that's normally used in an hospital setting. This medication chart normally has 4 pages, so I'll be walking you through page 1 to 4. Now, for a start here with page number 1, of course, we need to make sure that we got the right details of the patient over here. We use what we call the 3-point ID check. So I need the patient name over here, and then I need the date of birth and the UR number. This one can help me to identify the patient, making sure that we don't make any mistakes. On the left side over here, we need this part to be filled out so that we know what the patient is allergic to, so that we ensure that we don't dispense those medication, or when in the ward, they're not given to the patient because they're allergic to them. As you move down, you can see here we need the number of drug charts. So it's 1 of 1. That means we got only one drug chart. If there were to be 2 of them, so it will be 1 of 2. And this drug chart here has been ticked. It's valid for only 1 month. And then when we move down to this part over here, this is where we get the doctors to write the medication that needs to be given as a start dose, or straight away, or once only medication. And the nurses as well, they can use this one to request the doctors to give them an order, which will be more of a telephone order. If it was to be in the middle of the night where the doctors are not there, they can just call the doctor on call and just get that phone order and give it to the patient. As well, we can have the nurses to initiate what's required for the patient as per the policies, and then we can have the pre-medications just written up here as required. As you move down on this part over here, that's where we see when the patient get admitted to an hospital setting, we need to know what medication they've been taking. So if you're in the ward there, it's good for you to have a conversation with the patient, make sure that you know what they've been taking. Otherwise, with the pharmacies, we'll come and follow up with the patient and see what needs to be done over there. As well, as you move down here, we got what we call the prescriber's details here. The doctors will come and pull their details there to make sure that whenever they need to be contacted, we can just contact them. If we need their address, we can send documents as required. So that's page number 1, which is mostly will be your front page. And then as we move down to page number 2, you can see at the top here is where we got the regular medications or medicines which are given on daily basis. For a start again, you can see here we got the variable dose medicines. Here is where the doctors will prescribe medication that the dosage will keep on changing. For an example, here you see patients who are on corticosteroids, maybe they got COPD or that sort of condition. So you can have prednisolone just charted here, and the dose will keep on changing as we go. So they could start off with a dose of maybe 15 mg, and then the doctors will titrate this to 10 mg. And as we go, they continue to wean off, and we end up with 5 mg, and then they'll stop them. So the other part is where we got medication to prevent any clots, or what we call VTE risk assessment or VTE prophylaxis. In other words, it's just for prevention of those clots. Any venous thromboembolism prophylaxis and prevention of clots. So a common one that we normally see out there is what we call the enoxaparin, and it's been charted by the doctors. So it looks good, and it's been signed anyway, so it looks okay. If your patient is on anticoagulants, they'll be charted here. And one of the typical anticoagulants that we normally tend to use quite common is warfarin, or we can use the Coumadin. The other medication on the same page here, as you can see, is where the doctors will prescribe the medications as we go down here. These medications will be prescribed here, which are required on daily basis. So for this patient of ours here, we can see the patient is on tapentadol over here, which is SR, and needs to be given via the mouth. It's PO, and this dosage is there as 50 mg. It needs to be given BD, which is twice a day. And the time that it requires to be given is early in the morning at 6 a.m. and 6 p.m. because it's twice a day. And the doctors have signed here. So this one makes it a valid drug order as per se. Number 2 here as well, you can see the doctors have prescribed paracetamol. It's per oral, again, needs to be given via the mouth. It's 1 gram. It needs to be given QID, which is 4 times a day. So 6 a.m., there's midday, the 6 p.m. and 10 p.m. as required has been signed as well by the doctor, so it's all good as long as it's signed over there. As we move down to page number 3, again, we need to check the same thing here. The patient label or the patient details needs to be put here, so we need to know whom we are giving the medication to. Even if it's the same chart, the label needs to be affixed over here for the drug chart to be valid or more of a legal document. Again, we need to make sure that any allergies that the patient got or drug reactions or what we call the adverse drug reactions needs to be documented over there to make sure that we don't make any mistakes. As you move down again, you can see here again our patient got medication that has been prescribed over here, which I'll go through it. So we got a patient got esomeprazole, which needs to be given. It's per oral, it's 40 mg, and needs to be given MANE, which is morning. And the doctors, they've signed here. So by the look of it, needs to be given MANE, so it's in the morning, and that's becomes 0800 hours. And as you move through this drug chart, you can see where we normally get those small errors over there. That is written as 40 grams over here, but it needs to be 40 mg. So technically, you'll be going to the doctors and tell them to change that one for you. So the other one over here, as you can see, again, it's been prescribed over there, is Symbicort, and this one is given as an inhaler, and we got the dosage here is 205, which the patient needs to have 2 puffs, which needs to be twice a day. So when you see 200 by 5, it's 2 combination of medication in one. And I'll discuss this in the next session. If you go down over here again, you can see your patient has been prescribed more medication over here. So it's sertraline, which is per hour, it's 100 mg, and needs to be given Nocte, which is at night, and this becomes 2000 hours, and the doctors have signed. So it becomes a legal document again. And this is a typical example again of another medication which comes as a combination, which is simvastatin and ezetimibe, which is 80 mg by 10 mg. It needs to be given per oral again. It's Nocte, so will be given at nighttime, which is 8 p.m. The other one, we can see our patient here got cranberry, 60 grams, which is per oral, needs to be given in the morning, and that becomes 0800 in the morning. So if we move to the next page, that's where things change, because now when we move to the last page, which is page number 4, as you can see over here, this is as required PRN medicines. So PRN, in other words, is as required or whenever necessary. It's what comes under Latin, which is pro re nata, and means just when necessary. So the patient needs to ask for this. We don't go giving them. We can offer them, but it's up to the patient to ask for them. Or if you do your assessment and the patient needs them, you can offer the medication, and the patient, if they want to take, they can take it. As you can see here again, we can see the medication was prescribed. We can see the dates. And then we got the generic name of the medication, which is oxycodone. It's IR, which is an immediate release. And then we got Asparo, it's 5 mg. It needs to be given Q3H, which technically, depending on what the doctors want here, we could give every 3 hours, and we can always confirm this to see if it's every 8 hours, because it's not clear as well. And these are the things that you find that you need to clarify with your doctors. Do you mean this is every 8 hours, or that's a 3? And we can see here it's given for pain. And whenever we get the PRNs prescribed by the doctors, they always give us the indication compared to the regular medications, which they don't give the indication all the time. And then it's been signed over, that's why it's all good. For the other one, we can see here, if we were to work with this rectangle over here, we can see what has happened there. The doctors have prescribed, which is Cloxel and Senna. It's by oral. There are 2 of them, and then needs to be given BD, which is twice a day, and it's used for constipation. And over here, you can see how the documentation changes when the nurses give the medication. So we tend to use those sort of documentation over there. So the date is there. So we got the time, we got the dose, then it's by oral, then you sign it over there. Then as you move down over here again, the other one we can see over here again, what we got is more of lactulose. It's by oral is 20 mils, needs to be given TDS, which is 3 times a day. So again, we can see how the documentation looks like. It's PRN there anyway for all of them. You can see it's all PRN. And as you move down, you can see again on this part over here, your patient got ondansetron, which is used mostly for nausea. Ondansetron, it can be given by oral, it can be given IV, which is intravenous, or it can be given as sublingual. And we are giving 8 mg 3 times a day, and it's for nausea. And also the next medication over here, which is PRN as well, prescribed as PRN, is salbutamol, which we normally call the Ventolin anyway, or the Pafar, which is you can give 1 to 2 puffs whenever your patient got shortness of breath, or they got those symptoms of asthma. And as you move down to the last page, the last medication written over there, we can see tapentadol IR has been prescribed again. It's per oral, and you can give 50 to 100 mg. It's every 3 to 6 hours. If you look at this one, looks quite clear. It's every 3 to 6 hours. So it's up to you to do your pain assessment and give as required. And whenever they put 50 to 100 mg, it all depends what dosage you want to give as per your pain assessment. And that's the quick end of this look at the drug chart. And please subscribe to my YouTube channel so that you can get more updates as I work through these drug charts into details and do more medication calculations in future. Thank you.